I will also support the motion congratulating the McGowan government and thanking the Honourable Clara Andrich for presenting this, and indeed also the hard-working and indeed reliable Parliamentary Secretary for the words. Indeed, all of the words from all the contributors I would support. Now, as a hard-working doctor involved very heavily in mental health at the coalface, I can say that I very much appreciate every single dollar the government can put towards mental health. But I would also counsel that measuring success by the amount of dollars put out doesn't actually work. Because for all that we have seen in investment in mental health, at the ground level, we're not seeing that much of an improvement. The model of care needs to be looked at, the workforce and indeed the infrastructure, as mentioned by the Honourable Clara Andrich. The Children and Adolescent Mental Health Service is something which I would heartily recommend we look at closely, because the experience I have at the front line is that we're not getting a great deal, A, of access and B, of success. And we wonder why this is happening. It's not because money isn't being spent, but we would maybe look at how wasteful can we be in what we're actually using with our resources. It has been said that if we used our resources better, the outcomes would also be better, and that effort needs to be put into that area as well. So I would encourage that. The community is also a major source of mental ill health. Many, many causes for that. I could spend an hour here talking about this, and every single aspect will be addressed by whichever government happens to be in power. Alcohol use in the communities, indeed alcohol use everywhere, drug use and abuse, but also the physical abuse and mental abuse, the sexual abuse, which seems to permeate vast areas of society, resulting in children being at risk. Now, you may not know that as a GP, I had originally wanted to be a paediatrician. But I discovered I could not, because seeing children suffer made me suffer. I would be dead long before had I become a paediatrician, simply with the pain of seeing the suffering. So when I hear what's going on in society, with the mental health in particular, I feel pain. Having experienced that in my own family, I feel pain. Action needs to be taken, and I commend the McGowan government for this.